Thank you, Dr. Herman. It's an honor to be here tonight. So I was asked to do a presentation about mitral clip in low-risk patients. Can it benefit my patient? So I think in order to answer this question, we have to break it down in under three questions. Currently, mitral clip is not approved in low-risk patients. So in order to answer this question, we got to see first what the guidelines are. Part of it, you saw it in the previous presentation. Then, is there a need to actually treat low-risk patients with mitral clip? And then, how does the risk-benefit look for these patients? So the current ACC/AHA guidelines for primary mitral regurgitation say that if a patient has moderate to severe mitral regurgitation, it is recommended to perform mitral valve surgery, and if possible, preferably to do repair. Then mitral clip comes as a 2A recommendation for patients that are not candidates for surgery. And for secondary mitral regurgitation, mitral clip is the preferred therapy. Now this is a slide from an older study. It's from 2018, and on the left, there is a graph that shows the prevalence of mitral regurgitation in general population. And as you can see, right about at the age of 60, where our low-risk patient would sit, the prevalence of mitral regurgitation is about 2 to 3%. On the right, it's a table that shows what kind of treatment these patients got. And it looks like about 29% of patients got surgery. The rest of them didn't get any treatment. So 71% of patients, no treatment. Now this is a study from 2018, and since then, more mitral regurgitation has been found. So the prevalence is likely higher. So then the next question comes is, how effective is mitral clip in reducing mitral regurgitation? And if we look at this data from the EXPAND study, we can see on the right that at 30 days, mitral clip had a 99% implant rate and a 97% acute procedural success, which is pretty high. The last column shows the prevalence of severe MR more than 2+ at 1 year is actually less than 4%. Then the next question comes is, how do these patients feel? How do patients feel after we do the mitral clip? And we can see that at 30 days, immediately, they feel a lot better. So they have a 19% improvement in KCCQ score, and that is maintained up to 1 year. So as a conclusion, immediately after we put the mitral clip, we can reduce the MR, and the patients feel a lot better. Now, of course, these are low-risk patients, so low-risk patients, we want them to live long and do better for a long term afterwards, so durability is a question. And if we look at this data from the main studies that we have in mitral clip, we can see a consistent sustained reduction in mitral regurgitation up to 5 years. And the prevalence of mitral regurgitation more than 2+, it's very low. 80% of patients live with less than 2+ MR at 5 years. And then on the bottom side of the slide, it's broken down in primary and secondary, and those are very similar. It's also in the 80s for both type of patients. Then the next question is, okay, well, they felt good after the procedure. How do they feel later? And the quality of life improvement, it's maintained up to 2 years. And on the bottom side of the slide is also broken down in primary and secondary, and it's the same between them. Of course, these patients have a lot of heart failure symptoms. MR presents with heart failure. So then the question comes, at 5 years, how do they, at long-term follow-up, do they still have heart failure symptoms? And it looks like about 80% of them, they don't. And that is consistent in the 2 major studies that we have on mitral regurgitation and we have long-term follow-up on. And again, on the bottom side of the slide, it looks like both primary and secondary have sustained absence of symptoms at 5 years at long-term follow-up. As a consequence, if they feel better, they don't go to the hospital. So the heart failure admission reduction is maintained up to 3 years, and the number needed to treat is 3, which is very, very low. And the last thing that we need to ask ourselves for this low-risk patient is how is their mortality at 5 years or at long-term follow-up. And in this graph, we can see that the mortality at 5 years is pretty similar to surgery, which is the standard of care for these patients at this time. The next question that we had is how is the procedural success? What is the complication rate for these patients? And if we look at this data from the co-op trial, it looks like there is a 96% of freedom from device-related complication at 12 months. Here at the top is all complications, and on the bottom is all the other complications, the leaflet detachment, pericardial effusion, and altogether are below 4%. And that is from the co-op trial. Now, if we look at the other trials, and the main device-related complication would be a leaflet detachment. On this graph, on the left side of the graph, it's the immediate 30-day post-procedure single leaflet detachment, which is in the lower than single-digit rates, and that is maintained up to 1 year. So that means, if it doesn't detach immediately, it does not detach later. So it's durable. And again, this is from TVT registry. Also, the complication rate broken down. All of them is less than 2%. Stroke or leaflet detachment or MI, they are very, very low. 30-day mortality, extremely low. In the EXPAND G4 is 1.5%. So as a conclusion, there is a large number of patients with mitral regurgitation that are currently not treated that could benefit from this therapy. There is the Mitral Clip provides a very effective and durable reduction in the MR at a relatively low complication rate. And also, it has a very low and short hospital stay, which is about 2 days. Similar survival rates with current approved therapy. And of course, all these results need to be validated in randomized controlled trials.